Hi, my name is Dr. Ganan, and I'm a physician at Virginia Integrative Health. And one of the things I would like to talk about today is the OATs test, short for Organic Acids Test. And the reason I would like to talk about this test is it's extremely versatile. It's not very expensive, especially when you consider the amount of information that you get from the test. And actually, entire weekend lectures can go over all the different things that this test can do. So what I would really like to focus on is just how we use this test here at VIH for pain. And even that can be quite extensive, so I'll try to keep it short. This is an easy test to do. You come in and you give us a urine sample. And so for those of you who are afraid of needles, there's no worries there. But once we get this test back, there's different sections that we look at that we go over with each one of our patients to explain how it could be influencing the pain that you as a patient could be experiencing. And so briefly, I'm just going to hold this up so that you can see an example of what this test looks like. This first section, this whole first page is looking at gut health, okay? And many people don't realize how important the intestines are to our entire body being helpful. But when you think about human beings, we are a closed system. We have skin for a reason, to keep everything out, keep the environment out, keep all the bad stuff out, right? Well, every time we eat something, we're taking things into our body. And so the intestines are really the only way that we have to actually interact with the outside world and assimilate things. So it's very, very important that the intestines be intact, that everything be working properly. When that barrier breaks down and is letting bad things across instead of just the good nutrients that we want, we have a setup for inflammation. And as that inflammation worsens, our body starts to work not nearly as well, and that can get worse and worse over time. So it's very important to look at the health of the intestines. And so this first page is looking at that, and in this first section here, we are looking for yeast markers, namely Candida. Candida is very, very common. We all live with it, but the key is to have a little bit of it and not let it overgrow. When we have issues where Candida overgrows, unfortunately, Candida is very chemically active. It makes about 64 different chemicals, one of them being an alcohol, one of them being formaldehyde, and all the different chemicals that makes that causes inflammation, and that can increase how we are feeling pain. When we look down here, we're looking at another section of gut health. Now we're looking at different kinds of other bacteria. We want to see, do you have good bacteria? Do you have bad bacteria? Because again, that can be influencing the amount of inflammation in the gut and increasing problems with communication in what we call the gut-brain connection. Again, can be another entire lecture. As we move on to the oats, we look at oxalate metabolism. For those of you who know somebody or have had kidney stones yourself, you know kidney stones are very, very painful. Well, kidney stones 95% of the time are made by oxalate crystals that have precipitated out in the kidneys. You can have problems with high oxalate levels and not have kidney stones, but just like those crystals are painful in the kidneys, they are painful everywhere else. So we look at your oxalate metabolism. If you have a high level of oxalates, those oxalates are going to be depositing in your muscle, in your joints, and they're going to create more pain than you would have without those oxalates floating around. We are going to then, with the oats test, look more at your energy production. Okay, the rest of the middle part of this test is looking at how well does your mitochondria work. Mitochondria are the tiny little parts in your cells that make energy. Without the mitochondria, we don't do anything. Okay, so when your mitochondria are sick, when they don't make energy well, you can't do a lot of the things in your body that you need to do to function. And one of the side effects of that can be worsening pain, because you can't make the chemicals you need to deal with or get rid of the pain chemicals that you might be creating. As we go along, we're looking at metabolites of neurotransmitters. You really can't measure the chemicals in your brain directly, but what we can do is we can look at what we call the downstream metabolites. And that gives us an idea of what are the neurotransmitters like in your brain. And many of you have heard of serotonin. When you take drugs like Paxil or Prozac or Zoloft, that's trying to increase the levels of serotonin in your brain. When you take those antidepressants, it makes you feel good. Well, as we get to the bottom part of this page, now we're looking at neurotransmitters. That's the chemicals in the brain, the balance between what allows us to feel good, feel relaxed, feel angry. All of that has to deal with different chemicals that have to be in the right ratios. When those ratios are incorrect, we don't feel well and we can feel pain more. So now we're looking at things like serotonin. And for those of you who have dealt with antidepressants or know anybody on antidepressants, Paxil, Prozac, Zoloft, those are meant to increase serotonin in the brain so that you feel better. Well, this test is looking at what are those neurochemicals like in your brain? Do you have too much or too little? Is there the wrong balance? Because that influences pain. Okay, so rather than just say, well, you're depressed, let's give you this medication, we want to look a little bit deeper. What is your balance like? Because rather than just giving you medication, sometimes there's other things that we can do to influence how your body is creating this neurochemistry. Okay. As we look a little bit further into the test here, the main section here is we can look at your fat metabolism. If you're not able to deal with fats correctly, obviously not only can that make weight loss difficult, which again is a whole other section, but fats are very, very important to nerve growth, nerve development, nerve health. So if you can't process and metabolize fats correctly, that can influence your pain. Okay? We are looking at nutritional markers. We're looking at your levels of your metabolites of your B vitamins, vitamin C, coenzyme Q10. All of these things are necessary for various processes in your body, including detoxification, growth of tissue, healing of tissue. If these things are off, your body's not going to work as well. Inflammation is going to increase. And as a result, pain levels are going to increase. Okay? We can also look at, I mentioned briefly, detoxification. Well, we can look at, are you having a buildup of chemicals because your body is not able to detoxify well? Do we need to give your liver some help? And there are various nutraceuticals and different things that you can eat actually that allows your liver to detoxify better. But if you have a buildup or an excess of, let's say, ammonia, you're going to feel pain more. If you don't have enough glutathione, which is a very, very strong antioxidant in the body, you may feel pain more. So looking at detoxification markers is very important for assessing your pain. And we're also going to look at amino acid metabolism, just to make sure on the rare chance that there is what we call an inborn error of metabolism, that you can't process certain kinds of proteins well. If you can't, and there's a buildup of some amino acids, again, extra inflammation, and you could be feeling pain more. So that is a brief overview of the organic acids test and the things that we look at, the things that test allows us to read into your body to give us insights into why you may be feeling pain more. And rather than just say, oh, yeah, you're having some pain, take this Motrin or take this narcotic or here's an injection, come back in another week for more. While we may do injections for pain, it's very important to know what's going on inside biochemically. What are the things that set you up for pain? What are the offending agents that created the inflammation that brought about this pain in the first place? Because if we can correct those, if we can stop the inflammation, we can make significant changes not only in your actual level of pain, but also in your neurochemical perception of how much pain that you have. So come visit us at Virginia Integrative Health. I feel that we put together many different pieces of looking at the human puzzle that a lot of different practices miss.